The global shortage of surgeons disproportionately impacts low and middle-income countries. Zambia falls short of the 2006 World Health Report recommendation on the physician-to-population density of 22.8 per 10,000. To mitigate the chronic health workforce shortages, some countries train non-physician clinicians to perform procedures that were historically only carried out by doctors, a response termed task shifting and task sharing. The task-sharing concept is one that is supported and recommended by the World Health Organization, and for 20 years, Zambia has invested in training such cadres to fill the human resource gap in the delivery of healthcare. Non-physician clinicians can be trained to perform any surgical procedures at a district level, requiring shorter training times than doctors. They also have a high retention rate in rural hospitals, reflecting their willingness to live in rural districts.
We didn't have the luxury of doctors. In fact, the majority of the districts in this country at that time, we had about 70 districts, were manned by clinical officers as the medical officer in charges at district levels, because we didn't have the doctors. And when it comes to operations, we are just referring to the general hospital, including for a cesarean section and other surgical operations. So we came up with a curriculum, and a cadre called Medical Licentiate was born.
Non-physician clinicians' immense contributions in these underserved areas of the country has been key in addressing the high maternal and neonatal deaths. Since 2002, non-physician clinicians called Medical Licentiate practitioners in Zambia have been contributing to the delivery of essential health services at district-level hospitals. Initially, Medical Licentiate practitioners received an advanced diploma course at the Chainama College of Health Sciences and underwent a one-year internship. In 2013, the program was upgraded to the level of Bachelor of Science, which is now delivered by the Levi Mwanawasa Medical University.
They settled on retraining clinical officers so that they would become medical licentiates. Now retraining them, equipping them with more knowledge and skills, which were in the past a preserve of only medical officers.
This curriculum was informed by ensuring that the medical licentiate was able to do surgical procedures, was able to operate in terms of gynecology, in terms of obstetrics, a cadre who can do, for instance, a cesarean section, can evacuate when there is incomplete abortion, for instance, surgically someone who can do an appendicectomy, someone who can do a laparotomy, a hysterectomy, among other life-saving emergencies.
There is a lot of evidence of many patients' lives being saved by the timely intervention of highly skilled medical licentiates in many parts of the country. And these have high surgical and they also have emergency skills that are so important in saving many patients' lives in health facilities. So to that extent, one would say, yes, the objectives have been met because they have been able to fill up the gap, the shortages of doctors, especially in the rural parts of Zambia.
In the first intake, nearly 20 years ago, 25 medical licentiate practitioners graduated from the Chainama College of Health Sciences in conjunction with the University of Zambia School of Medicine. According to the Zambia Medical Licentiate Practitioners Association, slightly over 600 medical licentiate practitioners have been trained so far. However, 440 medical licentiate practitioners are on the register of the Health Professions Council of Zambia.
About 700 so far have been trained at both diploma level and also at degree level. Most of them are in the civil service. So far, 165 medical licentiates practitioners have been deployed across facilities and district hospital in the Ministry of Health. And out of these 165, 150 have been deployed in district hospitals across the country, with 15 deployed in hospitals within Lusaka district, respectively. The rest are in the Ministry of Defense and other ministries needing their services, as well as in the private owned hospitals.
This has been one of the success stories, because the medical licentiates, wherever they've been posted, when they've applied themselves, they've been able to save a lot of lives. In fact, to date, some of our districts, the people who are running the theaters, who are saving lives, are the medical licentiates.
Their contribution to providing essential surgical services in district and rural hospitals in Zambia directly addresses a critical dimension of health equity. And it has been shown that medical licentiate practitioners increase surgical productivity after deployment and are responding to an unmet need for emergency and essential surgery.
If you look at our setup in the health sector, we have a limited number of hospitals. For example, in Eastern Province, we have 2 main hospitals, Chipata Central Hospital and St. Francis Hospital. And this is where most of the doctors are found. Apart from the hospitals, we have district health offices, and now we have 14 districts in the province. And the doctors who are managing the districts are found in the district health offices, not in the health facilities. And in each district, there is a district hospital. So medical licentiates come in handy to support doctors who are usually 1 doctor per district, and the district health director will be in the office, and then you'll find the medical licentiate is the one who is running the district hospital. So medical licentiates have really filled in the gap that has been there for some time because of the shortage of doctors.
Even when they come here, it's not that you have direct entries only, but you have a mixture of both in-service and direct entries. And those give a good buffer in terms of human resource. Where we are lacking in terms of numbers, they come in and help us mop up the few things that will be lagging behind in terms of being able to deliver service to the clients on time. That's number 1. Number 2, the qualified medical licentiates. Whilst we have a limited number of specialists in the country, limited number of doctors, we have this fast-tracked route of training somebody who will be able to offer the minimum primary surgical services, both obstetrics and obstetric gynecology and general surgical, emergency primary services, which is a big benefit.
So I've talked to a number of experienced medical officers who are surgeons, and they will tell you quietly that they learnt their skills in many cases from a medical licentiate who was so good and so practiced at certain clinical procedures, and particularly surgical procedures. They did it really well. And so they, as baby surgeons, as junior surgeons, learned some of their practical skills from medical licentiates. So that tells you that this is a valued and valuable cadre of healthcare worker in the country.
That is not all. Medical licentiate practitioners have also played a critical role in the delivery of primary healthcare services in the country.
The reduction in maternal mortality in this country, the reduction in infant mortality and under 5 mortality, it will be fair on this platform to attribute it in a way to the role of the medical licentiates, because medical licentiates have strategically been placed within the primary health care. So they have been the backbone of the primary health care, and we are indebted to them.
This is St. Margaret's Mission Hospital in Chifunabuli district in the Luapula province. The hospital is about 115 kilometers away from the provincial capital, Mansa. Evans Nyumbu is a medical licentiate practitioner and works for St. Margaret's Mission Hospital. His decision to become a medical licentiate was largely driven by his desire to help others.
My favorite place is theatre. I love being in theatre, operating on people. What makes me enjoy in theatre is situations where a patient has got a problem, then you operate on them, and then someone who was seen to be in pain, someone who was seen to be in a very difficult situation, and then they recover and they start smiling. That gives me joy.
Medical licentiate practitioners have advanced clinical skills, including training in plant and emergency surgery to meet the surgical needs of rural populations. Apart from providing surgical services, medical licentiates' work entail conducting ward rounds, which provide an opportunity to inform and involve patients in healthcare delivery. But very often, patients do not know who a medical licentiate practitioner is.
They know much of the two cadres, a doctor and a nurse. So if they see me in a uniform like this, I am a doctor to them. So even when I move around the streets of Cassava, they call me doctor. They don't know who a medical licentiate is. They may have quite a few ideas about a clinical officer, but with a medical licentiate, I think they don't know.
When you are together with a medical officer in the ward, maybe they will call you doctor. So sometimes the medical officer who is there feels they are calling him a doctor as well. So sometimes it becomes a conflict where maybe you make an advice to this patient that you need to do this. Then this medical officer comes and the patient tells him, the doctor told me this and this. So that's what I'm following. So sometimes the medical officer, he will not take it. So others, they will not take it easily.
Medical licentiate practitioners are mainly stationed at district hospitals, but sometimes they are found at general and central hospitals depending on the need. Dorika Mpande has been practicing for 5 years. She first worked at a district hospital for 3 years before moving to St. Francis Hospital in Katete, where she is involved in taking care of HIV patients. Medical experts believe task shifting in delivering HIV and AIDS care results in good patient outcomes.
Medical licentiates are involved in the screening of the patients from the outpatient ward. They're also involved in doing the ward rounds in the wards, that's the medical wards, pediatric wards, surgical wards, gyne wards, up to maternity wards. They're also involved in doing surgical procedures, both minor and major procedures.
Although medical licentiates have made a huge difference in the lives of many, they face a lot of difficulties. The major barriers to remaining in a district hospital position as perceived by medical licentiate practitioners were lack of a more attractive salary elsewhere and an unclear career progression within medicine.
The challenges has been the use of tools, like the experience I had at the district hospital. Yeah, I worked there without an anesthetist to do operations as a surgeon and as an anesthetist, monitoring the patients, both sides. While you're operating, you're also giving instructions for anesthesia and also monitoring how the patient is doing. So that was quite challenging. And then also because of the shortage, you find that you are on call nearly every other day.
The other challenges is when it comes to maternity. yeah, you'd find that there are challenges like PPH, patient is bleeding, and then you don't have blood at the facility, and the only place where you can refer your patient is in Mansa, and from here to Mansa is about a distance of 3 hours driving. So it becomes a challenge.
Sometimes you say we can handle this case, then maybe your senior will come and say, no, we need just to refer this case. Now, because of you are a junior officer, it is coming from the junior officer, then this is a senior officer. You have no much to say because the senior officer is in control. So sometimes it's a challenge.
The other hurdles medical licentiate practitioners face is lack of a clear career path. As a result, many are leaving the practice.
The program doesn't really have a step-up ladder, one where we're allowed to branch from maybe the degree that we have to a master's program or a PhD. There's no direct entry right now into any program. Most of the programs are M-Med, meaning you must have a degree in medicine for you to advance to a PhD. So most people have actually left the program. They'll train as an ML, they work for a few years, then they can't advance. So they know the only route is they go back to school, they do a different training, they branch in something else. So you find that in a year, maybe new entries to the program will only be maybe 5 or 6. And there are more people exiting the program than more coming in.
Their certification is Bachelor of Science in Clinical Medicine. Those, in some institutions, they call it a Bachelor of Science in Clinical Science. After they've attained that, there are no avenues of advancement. It just ends there. It's a dead end.
They don't have positions for promotion as medical licentiates. As the program was expanded, the establishment which provides position for medical licentiates has remained small. So we have good number of medical licentiates, but they are not being absorbed at that level. So they will work as medical licentiates and yet they remain on the payroll as clinical officers, and that brings a lot of frustration to them.
But the government says the issue of promotions is being addressed.
The idea behind the 11,200 human resource to be employed in the health sector is actually meant to address some of those challenges where certain cadres do not have positions created, and even where certain positions have been created, there has not been what you call treasury authority. So you have a group of people working as, but not recognized. So what we want to do under this program of recruitment is to create a level or to establish the very positions that are required in every category so that those who are supposed to be there but are at a different level can fill up. And then by filling up, then they will leave space. And then it means those below who should be at this level also be raised up until we get to the lowest, and then we can employ if there's any shortage there after doing that. So that's basically a challenge not only for this category of assistant medical officers, but it's a problem for all the various categories of medical health workers, and that's why we want to ensure that we solve this problem through this recruitment using this 11,200.
There are organizations that take the provision of healthcare seriously. SolidarMed and Lichtenstein Development Service are some of them. SolidarMed is a Swiss NGO and works across East, Central and Southern Africa. In Zambia, SolidarMed and Lichtenstein Development Service have been supporting the health sector in many ways.
In our early support, we were involved in direct training and providing clinical expertise to help train up medical licentiates in things like surgery, pediatrics, etc. More recently, in the last 2 years, we've shifted our focus to supporting the systems that underpin good undergraduate clinical training. That is, we are assisting in improving the teaching quality So that is helping doctors with teaching skills and what we call pedagogical skills. And we also helping to improve the learning quality. And in that space, we're working with partners at Heidelberg University to develop e-learning content and to help develop the learning platforms so that students, ML students, wherever they are in Zambia, can have access to good quality learning materials.
We also recognise that it's quite difficult for health workers, particularly in rural Zambia, to get good housing. And there isn't enough housing, and it's sometimes not in very good condition. And it's demotivating for them to stay in a rural area if they don't have good housing. So one of the things that we've done is set up a social enterprise that builds and rents houses as an affordable rent to healthcare workers. And it therefore creates a revenue stream whereby we can maintain those houses and even build some more.
They have been providing financial, material and technical support to the Medical Licentiate training program for the past 10 years, resulting in increased output numbers of trained MLIs, but also ensuring quality in the training. They have provided infrastructure support, not only by putting up some student hostels and skills labs, but also equipping skills lab in different health facilities in the country.
Over the past 11 years, SolidarMed has witnessed a steady increase in the number of medical licentiate practitioners.
If you look at a graph over time of the number of medical licentiate students or graduates, it's been a slow, steady increase, and we've supported that. And there's now a step change in the number of students that are studying through Levi. So that, in a sense, you could say that's an outcome in itself. The fact that the country and the university wishes to train more medical licentiates, because it recognises that we need people in rural areas who can do essential clinical and particularly surgical procedures to save lives.
Chipata Central Hospital in the Eastern Province is one of the recognized surgical training sites for medical licentiate students. Medical licentiate trainees from Levi Mwanawasa Medical University undergo an 8-week attachment where they are exposed to a number of specialties in general surgery.
Among the areas of interest for them is one to expose them to the emergency and trauma unit, which is our outpatient unit, be able to appropriately pick out cases that need emergency and those that can wait, so to say triage clients, and offer immediate and appropriate services to minimize morbidity and mortality to our clients.
St. Francis Hospital in Katete has been a training facility for a long time. Many medical doctors and medical licentiates have passed through this hospital. St. Francis is a busy hospital.
In a quarter, we do about 1,500 surgical operations, and you'll find the number of fully qualified staff is very limited. So the advantage that gives is that there's a one-to-one interaction between the medical licentiate in training and the doctor, the senior doctor who is conducting those operations. So they get the skills not through only through learning in class, but they have got hands-on skills.
Mapenzi Jinda and Richard Tuchili are fourth-year medical licentiate students at Levi Mwanawasa Medical University. Mapenzi is a direct entrant, while Richard worked as a clinical officer before he enrolled into the program.
We have the theory part, of which theory part is not so much. Most of it is practical. So things make more sense when you practice them. Unlike when you're talking about things that are not real. But once there is a patient with you, those signs and symptoms that you learned in class, you apply them on a patient, it sticks more to the head.
It has brought me to a realization that there's so much that I thought I knew, and being involved in the inner circles, it has made me a better clinician, basically because I've been given the skills and knowledge that will make me a competent person to see that I position myself to offer the better service delivery to the community.
The shortage of manpower in the health sector is not a secret, but the country has been struggling to absorb graduates, including medical licentiates, in the health sector.
Right now, Levi Mwanawasa is training medical licentiates. But we also want our ministry to incorporate so much of recruitment of medical licentiates. On average, you only have maybe 3 MLs who are employed on a yearly basis. So the incoming is more than those going out. So if there was an arrangement or a setup where we could have a memorandum of understanding with the Ministry of Health, where they would incorporate a certain number, maybe even just 10 employment opportunities. Because as it stands right now, we have to depend on somebody leaving the program for somebody else to come in. There's no vacancy arrangement per se. So the few people that are leaving are the ones who are leaving space for us to come in.
Medical licentiates have made huge contributions in the health sector. But how does their future look like in Zambia?
The government has rolled out the construction of mini hospitals spread across the country. This is enormous. It has never happened for a long time. And because of that, there is this human resource gap, especially in medical and surgical skills. And with the numbers of doctors that we have, they can't meet that requirement in terms of the numbers. So the medical licentiates come in handy to fill in that gap.
They're a relatively new profession, and as such, the entire system of the Ministry of Health has to flex and change in response to the fact that there is a new category of clinician in this space. And I think with the advocacy endeavours that we're pushing ahead with, I think it's our job as SolidarMed and through the Lichtenstein Development Service to help with that and to help engage the Ministry of Health and our partners in this space to advocate for more places and to advocate for medical licentiates going forward.
The importance of this cadre, this assistant medical doctors, is so important even today, especially when you look at the fact that this country is huge. We have many health centers across the country, including the new ones which in the last decade have been constructed but have no doctors. We still feel that this specific cadre could actually help us. So their importance will continue being recognized and appreciated.
With their rare skills, medical licentiate practitioners have changed the lives of many in rural parts of Zambia, and many are hoping that government will find a permanent solution to the problems they face.